My name is Marianne Maldonado, and I'm the CEO of the World Affairs Council of Greater Houston. It's my pleasure to bring you today our guest, Mariela Poleo, who is currently the Interim General Manager for Government and Public Affairs, Community Relations, and Social Responsibility, and the Manager for Citgo's Simone Bolivar Foundation. We're so pleased all of you could join us today. Our conversation is going to focus on the current situation in Venezuela and the humanitarian work done by Citgo's charitable arm, the Simone Bolivar Foundation. Before we get started, I want to share with our viewers a little about the foundation and about Citgo. I hope you all are enjoying my cat attacking the flowers behind us. It's an exciting action feature we're bringing you free of charge today. So apologies for the distraction. I hope you enjoy the comedy behind me though. So many of you are familiar with Citgo and their stations all over town, but you may not be as familiar with the entire operations of in the refining industry. Citgo is headquartered here in Houston, Texas, and it operates 3 refineries in Corpus Christi, Lake Charles, and 1 in Illinois. They wholly or jointly own 48 terminals, 9 pipelines, 3 lubricant blending plants, and packaging plants. They have an astounding 3,000 employees and a combined crude capacity of approximately 769,000 barrels per day, and they're ranked as the 5th largest and one of the most complex independent refiners in the United States. A little about the Simone Bolivar Foundation. They are a 501c3 nonprofit private foundation of Citgo Petroleum Corporation, and they're dedicated to catalyzing organizations and resources to meet the humanitarian needs of Venezuelans and Venezuelan refugees. Our Global Connections conversation, again, is with Citgo's Mariela Poleo, whose work focuses on government and public affairs and also leading the charge of the Simone Bolivar Foundation. Mariela, welcome to our program today.
Marianne, thank you very much for inviting me. I'm excited to have some time to talk a little bit about, especially about what the Simone Bolivar Foundation is doing towards Venezuela.
Well, thank you again. And I know as a native Venezuelan, I know you must have a strong sense of duty and passion for your home country. And you have decades of experience in industry relations, financial management, and those both seem well suited for your role with the foundation. So maybe you could tell us a little about your background and how you found yourself here in the US, in Houston, Texas, now working for Citgo and the foundation.
Yes, sure. Well, I've worked in the oil industry for all my life, for more than 25 years, mainly in companies that are related to project management, or in the past 21 years, I worked with Equinor, which is the Norwegian oil company. And I started working with them in Venezuela, and after that, I have lived in Houston. I moved to Norway, and I came back to Houston, which I call home now. I have been able to work in exciting projects, major capital projects in different parts of the world, including Venezuela, Africa, and Latin America, and Central America, and North America. And I worked with the company until last year. And when I found the position for the president, manager, and president of the Simone Bolivar Foundation, I thought that it was a great opportunity for me to work towards the country, which is in very much need. I'm originally from Venezuela, and then also because the foundation is moving, or it's changing its vision and its mission. So it was professionally, it was a very interesting challenge where I can bring all my expertise from project management, strategic management, and thinking and process oriented, to bring it to this new stage of the foundation.
And a much warmer climate than Norway.
Definitely, yes.
So tell us a little about the mission of the foundation, what you do, how you do it for our friends.
Yes, the foundation, as you said, is the 501c3 organization, the nonprofit from Citgo Petroleum Corporation. It was established in 2006, and the main objective was to provide support to patients that had very specific conditions that were not treated in Venezuela. And the foundation provided help to these individuals to travel abroad with their families. It's mainly pediatric patients, and to receive the special treatment. Last year, given the complex humanitarian crisis in Venezuela, the board of directors started evaluating whether the financial model that we had was the right one. And instead of paying, these grants for a small group of individuals, how could we, with the limited resources that we have, how could we provide a greater impact in Venezuela? And with that, we revised the vision and the mission. Our current mission is to provide access to health to individuals that are affected by disaster, by poverty, or by conflicts, especially mother and children from Venezuela, in Venezuela and outside of Venezuela, because we see that there has been a major migration of Venezuelans also. So we're not only looking at Venezuela, but the region in general. With that, the foundation then is going through a process right now where we have three main objectives. The first one is access to medicines, nutrition, and well-being. The second one is about building capacity for the medical professionals, and I can elaborate a little bit later on that. And the third one is about empowering NGOs. Because we don't have boots on grounds in Venezuela right now, we believe that the NGOs that have presence in Venezuela, we can support them by providing them training and help them build competencies, because they are the ones that will be able to rebuild the country in the future.
So I know you might have maybe some more insight into the enormity of the Venezuelan refugee crisis and where most of them have fled to. Maybe you could bring us up to date. All we know is what we hear on the news, and you might have a little more in-depth insight.
Yes. Well, what I have is information that it's available on the network, and actually in our webpage we have a document that refers to the situation of the Venezuelan diaspora. But the interesting thing is that Venezuela has now more than 5 million inhabitants, 5 million people that have left the country. Back in 2015, the country that received the most of the Venezuelan immigrants was the U.S. But over the past years, we see that it has changed to Colombia is now the major Venezuelan intaker that has more than 2 million inhabitants, and Peru and Ecuador are the other ones. So you see, and the images are very devastating when you see people crossing the borders and walking all the way down to other countries in Latin America, just looking for a better way of life. No? And now with COVID-19, we see another effect that is, with all the COVID restrictions in these countries, where the people are not able to work, then they're going back, some people are going back to Venezuela. So you see influx, in and out of Venezuela because of this situation, even though borders are closed now, but it's an interesting effect.
So a mass amount of refugees. What are some of the most priority needs that you've identified that need to be met for these refugees?
Yes. Well, for the region, I would say that nutrition and especially in Venezuela, nutrition is something that worries us very much, given that with the COVID-19 you have restrictions in terms of mobility, and most of 60% of the population in Venezuela have their employment is kind of like informal employment. So they make their money based on a daily work. They don't have like a steady income. So with the restrictions of mobility, these people are not able to go out and find generate income. So that's something that that's very concerning. And then for the refugees also, the other issue is about medicines, that when they leave the country, those that have chronic diseases that require medicines, they don't have access to that kind of medicines. But I think the crisis is so wide that it's about hygiene. When you see the effect in Venezuela of COVID-19, you have poor hygienic conditions trigger COVID transmission. You have the lack of gas there's gas shortage in Venezuela, so it's not easy to do distribution of products or medicines, whatever. You have, as I said, nutrition. It's so many things. The state of the public system in Venezuela, the hospitals, are not prepared to handle these situations. So it's many elements going at the same time, basically.
It is very complex, and it's an emergency, quite honestly. It's not something that can be put off or planned for. How is the foundation currently supporting this complex issue?
Yes, I think that this year, when I started in the position on March, and I worked in the office for 1 week, and then we were sent to work from home. No, but the first thing that we said is, given all the situation in Venezuela, when we heard about COVID, we feared that the effect was going to be worse in Venezuela because of all the conditions that I mentioned already. No, so our first plan was to have an emergency response fund to provide support for PPE, for personal protection equipment, to personnel in Venezuela. And with that, most of our activity at the beginning of the year was related to COVID-19 initiatives. We launched the Emergency Relief Fund, and then we launched an open call for proposals for COVID-19 projects in Venezuela that range from personal protection equipment, communication, nutrition, wash, hygiene and sanitation. And yeah, I think those are the main areas. And with that, we were able to provide more than $500,000 in support to Venezuela. And we just closed another open round for PPE to medical professionals in Venezuela, because we see that the need is still there. No? And then in parallel, we are also partnering with larger organizations that have experience in Venezuela to provide other kind of initiatives, but I can speak a little bit later after if you want to.
Why don't you tell us a little bit about those now? That kind of leads us into my next question.
Okay. Yes, there's the way that we see the foundation is that we have, as I mentioned, we have the role to empower the NGOs. And we're doing that by helping them build corporate governance and by training them. And we have done several programs to train our grantees in applying to grants, so they can apply to our grants, but also that they can apply to other organizations, and then it will be kind of like a multiplier effect, and we'll see, the effect in Venezuela at the end. But then also we see that we need to pair or to have strategic associations with organizations that are already present in Venezuela, larger organizations that have the know-how of operations in Venezuela and that have the solid reputation of performing, in a good manner. So we entered into 4 agreements recently. It's for Venezuela and the region, I have to say, because we're also working with Latin America and the Venezuelans in Latin America. So we entered into agreements with Pan American Development Foundation to provide chronic medicines to patients. We entered with Aid for AIDS for a nutrition program. We have Food for the Poor, who's delivering food to immigrants in Colombia, and also we just announced a grant to the Red Cross for emergency response in 2 areas of Venezuela that will be providing health days to individuals.
Yeah. So tell us a little bit about how the Bolivar Foundation and the community and social responsibility differ between Citgo and the foundation.
Yes, Citgo has 4 pillars of activity. One is disaster relief. And I think that, Citgo in general, and as many companies, our focus is to be a good citizen. And the first part is by providing work or employment to individuals in, where we have activities, no? And then also to get involved with the communities where we are present, no? So with that, we have 4 pillars. The first one is about disaster relief. And you see that now Lake Charles is one of our where our refineries is, and it was hit not only by one hurricane, by two, Laura and now Delta. And we have specific actions that we took in terms of supporting our employees and supporting the community. And then we have education. We support different initiatives for STEM education and grants and scholarship for students in the areas where we are. And we believe you can build a pipeline, by educating the people in your community that will afterwards will be able to work with you. So it's education, it's disaster relief, it's health. And then with health, we have the Simon Bolivar Foundation, and we have the Muscular Dystrophy Association, which is the other component that we help. And I'm missing, hold on, disaster relief, environmental. Of course, that's the fourth element, where especially coastal support, or for managing environment on the coast. That's one of the issues that we collaborate. So Citgo CSR is related more towards the community where we are, while the foundation is more, it's within one of the four pillars, but it's focused on supporting the main shareholder of which is Venezuela.
So domestically, locally, you have a great support network, obviously back in Venezuela. So your work now has transitioned a little bit in the foundation, mostly to ensure that you're covering a greater number in supporting a greater number of Venezuelans, whether they're affected by the escalating COVID-19, humanitarian crisis, poverty, disaster. How do you work with existing NGOs in that region?
One of the things that has surprised us as we're working in this year of transition is the amount of organizations that are outside of Venezuela, created by the Venezuelan diaspora, that is willing to support. It's amazing. I mean, we have seen, from very small organizations that have a couple of people to larger organizations, but the desire to help from abroad is enormous. And that's something that is very important. No? With that, you can see that many of these organizations are young organizations, and they don't have, as I said earlier, the governance probably. So we see that our role is not only to award grants, but also to help educate them to be prepared for the future. These organizations, we support organizations here in the US, and they work with organizations in Venezuela also. So it's kind of like the whole value chain, in the sense that we support them and they support the organizations in Venezuela. We reckon that because of all the complex situation in Venezuela, it's not easy to work in Venezuela. And we have to be very flexible in terms of change management, because things change. I mean, prices change, logistic change, and we have to help them to have systems in place where they can document what they do, and where they can also have project management skills to manage their projects in a transparent way, in an organized manner also.
Mm-hmm. So that's very, very interesting. And I know that it is so complex, and COVID has not helped the situation by any means. How is your selection done? Tell me how you govern that selection, how you collaborate with these different organizations. We have a number of Venezuelans in our World Affairs Council community, and I know they'd be interested to learn, what specifically you're looking at, how you select, and what areas of Venezuela you select in.
Yes, well, I think that the question has two areas. Now, the first one is, how do we select the organizations? We have a very thorough process. And one of the things when I interviewed for this position is I always talked about three words. It was about governance, transparency, and collaboration. No? If you visit our webpage, which is www.simonebolivarfoundation.org, we have a tab for grants, and there's details about the requirements that we have for the grants, and the criteria, the selection criteria that we have. No? We have two ways of awarding grants. The first one is through an open call for proposals, and the other one is a selective process when we have a very specific criteria that we want to meet, like in the case of the large, medium to large grants, where we identified the organizations based on the criteria that they had to have to be registered as a 501c3 or equivalent. They had to have demonstrated operations in Venezuela, and they had to have a solid financial performance. No? But for the open round of proposals, we define very clearly the selection criteria, and usually we look at meeting the objectives of the program. It has to be, it has to create an impact. It has to be cost effective. It has to have a clear project execution plan, and it has to be implemented on a short term. No? So with that and a clear scoring rubric, we have an advisory committee team, which is formed by external members of the community that have higher education. They have master's degrees or PhDs, and they have experience in grant making. They have experience in health, in nutrition, and experience in Venezuela. And they evaluate the proposals based on this. No? The same committee evaluates also the larger grants. But what we try is to ensure that we have processes in place that are very clear. And with that, we ensure that, that the applicants know what they're doing. We do a very thorough process about evaluating the organizations. We ask them to provide information about who are the board members, their capacities, their previous experience. And it's the same as like in a procurement process in the oil industry. No? We follow a very similar process. And then we have a due diligence process that is very detailed for the selected candidates. We have a due diligence process with a third party, which is the same as the one that we use with Citgo, that evaluates the organization more in detail.
Citgo is well recognized in the community, and I know that you have some great new initiatives planned for 2021. I'm going to weave in one of our student questions. Could you tell us a little bit about your 2021 plans and the work you're doing with the International Federation of the Red Cross?
Yes, in regards to the 2021 plan, we see that we will continue with the grant making process. What we want is, because there are so many needs and there's limited resources, we want to make sure that we choose the right projects for next year. And we're planning an event for next year, still in the planning phase. I cannot comment much about it, but what we want is to involve stakeholders that can also provide feedback to us about what are the areas where we want to go. We had six webinars during the year that address different topics like migration, nutrition, the role of the NGOs, the humanitarian crisis, and that has provided information for us about the way forward. But probably this other event will ratify and help us build our activities for next year. But it will be within the health sector, and then the main areas, as we say, is access to medicines, it's capacity building, and it's empowering of the NGOs. And in terms of, oh, sorry.
Go ahead.
No, in terms of, you asked about the Red Cross. The program with the Red Cross is the one that we just recently announced. And it's a program where we will be, the Red Cross will be leading in two areas of Venezuela, Caracas and Estado Bolivar, which is a very poor country, state, sorry. They will be conducting health days. That includes, checking the patients, identifying if they have any need for medicines, giving them speeches about different health items. And it will reach, I think, I don't have the number, sorry, I don't have the number in my head, but I think it's over 6,000 people that will be benefiting from that.
Wow. That's great. I know many of our community would love to understand how they could get involved. Do you work with any organizations in either your CSR efforts with Citgo or with the foundation here locally?
Yes, locally, Citgo works with several organizations, but I know that, as I mentioned, the muscular dystrophy association is the one that we work with health. And we pair with different organizations. You can see more in our webpage. I mean, I'm just starting this position, so I'm not that familiar, but I know that we work with United Ways and we work with other organizations like Rebuilding Houston and several other ones. And then with foundation, Citgo is the only donor to the foundation. We don't receive donations from third parties, and we are not using volunteers at this time. But what we do have is in our grant page, we work with several organizations in Venezuela that they do receive funds. And if people want to donate to Venezuela, they can do so through our the organizations that are listed in our webpage.
Well, Mariela, this has been fascinating. I was not familiar with the great work that you're doing through the foundation, and also that Citgo does. I know it is complex. There's a lot of factors involved, and we're just so appreciative of you taking the time to share with the council a little bit about your new work. Congratulations on that, and we're so thrilled that you could join us today. Thank you. Any last comments?
No, I appreciate, Marianne, that you have given us the opportunity to present a little bit about the foundation and Citgo. I want to thank the participants that attended the meeting, and I would like them to invite to learn more about the foundation on our webpage, www.simonebolivarfoundation.org, and also to follow us on our social media. We have Twitter and Instagram, and it's at Fundación SBVE. So they can follow us. Thank you very much.
Well, thank you. And for all of you joining us today, I want to make sure that you check out our next week's conversation on Global Connections. Our guest is going to be Liz Schreier. She's the president of the U.S. Global Leadership Coalition. We're going to have an amazing conversation on foreign policy and the coalition's work on strengthening America's international affairs programming. So you can register for that program and see all of our programs at wachouston.org. Thank you all for joining us. Have a great Friday. Have a great weekend, and see you next week. Thank you, Mariela. Thank you all.
Thank you very much. Bye.